So minimally invasive procedures right now depend on X-ray and contrast to highlight anatomy and tools that the physicians are using. And so that is a 2D image, and if physicians are trying to understand where they are in the body, when we give them a hologram, they're not interpreting an image. They're looking at a patient's digital twin as a body part, and they don't have to use contrast to highlight the anatomy. They can just navigate through the body part. When we arrived here, it was a really great opportunity for us. As an entrepreneur, I had experienced a lot of accelerator programs, but this is the program where I could really sit down and work. And so our time at Fogarty Innovation, I always remember it as the most productive time for the company. We just did a lot of things that at other environments was just hard to achieve. What the Fogarty innovation team is great at is that they can very quickly direct you to the most important things that you need to focus on. For EchoPixel early on, that was our FDA clearance. And we were able to work down the hall with a group of physicians that we took input from for the product. And they were the team that helped us in the validation study for our FDA clearance. That focus and the ability to have the right environment to work really allowed us to be very effective in the early years as a startup company. So some of the more recent stories from patients that benefit from EchoPixel software, a patient that suffers from atrial fibrillation and had to, on a day-to-day basis, take blood thinners, was struggling with constant bleeds. So there is a device that can be implanted in the heart that allows him to not have to use the blood thinners. But because he had a late-stage renal failure condition, usually these procedures are done with X-ray and a lot of contrast to be able to navigate a catheter from the right side of the heart all the way to the left and implant a device on his left atrial appendage. So using EchoPixel, we were able to do that with ultrasound and allow the physician to accurately implant that device without needing to use any contrast at all. And so the ability for that physician to see the heart floating on top of the cath lab table allowed him to very quickly, in 20 minutes, cross from the right side of the heart to the left side and implant the device. And now the patient doesn't use any blood thinners.